There's been so much uncertainty surrounding when SNAP benefits would be paid out in November. And now we know the Trump administration is paying only 50% of those eligible. Let's start by asking what the impact is on the ground for the millions of people who rely on this to help put food on the table.
So let me just start off and say that typically families that get SNAP benefits, very often, even before this, they don't last for the full month. So we're already having people that were probably very anxiously awaiting this for November 1st. As you've already had on your program, there are many charitable food organizations that are trying to help give out food as well. However, the amount of money that SNAP has is about 9 times as much as what is typically given out by charities. So even if they increase, there's still going to be a shortfall for these families.
So now we know that, the SNAP benefits really do not last these families the whole month, as you say. Now, the program does serve about 1 in 8 Americans. So without this, where do these people turn to, especially if this keeps dragging on?
It's a really good question, and one of the reasons why I hope that the shutdown will end soon. One thing that they can turn to is charitable food organizations, like you've been reporting. Another place that they could turn is for children that are in school. They can get free school meals, and many schools offer breakfast, lunch, and sometimes even an after-school dinner for children who stay for after-school programs. So that could help to stretch a family as well. If there's people that are older in a family, then they could actually possibly go to senior centers that offer free meals. That again could help to stretch the food for a family during this time of great need.
All very good tips, of course. Now, the state governor of New York, where you are, has declared a food emergency, I discovered, to help channel funds to kitchens, charities, but food pantries. Is there a national food emergency?
So I'm not sure I'm the one who could judge that. I wouldn't say we're there yet. However, if this drags on, I think we would be in a state of emergency. One of my colleagues' husband works at a food pantry every Friday in regular times and was there this Friday, and it was absolutely packed, that they typically don't open on Saturday, and they opened on Saturday and again had many people coming for food. So I think this could quickly turn into an emergency across the United States.
Of the many services that are being suspended due to the government shutdown, this one is hitting home for many. Do you think it might have enough of a groundswell to force politicians to reopen government?
I don't know, but I sure hope so, because I think there are people across the two political parties, across every state in the United States that rely on SNAP benefits. And it isn't something that people is a nice to have. This is essential for people to eat. So I do hope that all of this groundswell of concern for people that really will not have food will be something that will get the politicians to end the shutdown.
And of course, come Tuesday, this would tie for the longest shutdown in U.S. history. Any thoughts on that in particular?
So not a proud moment for the United States, for sure. And I think that what we want to do is all of us to get in touch, those people that are in the United States, to get in touch with the people who are representing them and say that we need these services that the government provides. It shows how crucial the government is to the day-to-day lives of everyday Americans, and especially people who are in a time of need.
And of course, the other big concern, health. Over the weekend, people saw what health insurance premiums would become if they enrolled, of course, now during the open election, assuming subsidies come to an end in December. How do you think this might also nudge congressional negotiations? Because you've got high healthcare premiums and not enough food benefits.
Yeah, I think it's going to escalate to show the need for this, to show that People are already paying more for food. There's been inflation on food already over the last many years. People have seen the amount that they pay for healthcare go up, that I think people are going to say, we need these government programs. Another way that this could affect health is, one, we know, and there's much research that says this, is when people are under stress and experiencing trauma, that decreases their health. Also, when people are relying on maybe less expensive but nutrient poor foods that are how the US food supply works, they will be eating these foods that tend to lead to the lifestyle related diseases that are related to diet, such as type 2 diabetes. So if this drags on, we are also increasing the health risks of people who have very limited amount of money for food and therefore are going to turn to the foods that might fill their tummies but not give them the nutrients that they need to be healthy today and healthy in the future.
And then there's also this one other aspect I'm thinking of. It's not just if the shutdown continues, but even now, if it all reopens in the next few days, what has the long-term impact been on the health already from just these past few weeks of services ending?
So again, I think many people have experienced a lot of stress from this. I also want to reiterate that in the budget reconciliation bill that was signed by the president on July 4th, sometimes called the Big Beautiful Bill, already in that, SNAP benefits were going to be reduced, not cut like they are now and not given out, or only partially given out, but reduced. Also, I work in nutrition education. The program that was called SNAP Education, that was helping families learn how to cook, how to stretch their budgets, how to be excited about eating healthy foods, that got completely cut. And that is affecting every state in the United States to have people be able to learn less about foods. So that is also going to make health worse and make it harder for people just to figure out how to make ends meet with limited budgets and eating a healthy diet.
Thank you so much for your insight on a very important topic. Pamela Ann Koch, thank you.